Oncological Association, Turkey. Because as well, today's speaker is a coaching head, Dr. Srikumar, to know further. Thank you and welcome one and all. Suresh sir, the floor is yours. We are really waiting for your.
Yeah, thank you, sir. And I hope this was a presentation I made to another forum, and I hope this information will be useful for those who are practicing in counseling setting. And the topic which I am going to present today is take a minute to share my screen with you all. So can you able to see my screen?
Getting loading. It's getting loaded. Yes, what is counseling? I can. Yes, I can. We can see.
Thank you. I take this wonderful opportunity. Everything it will not come to you unless it is determined by you. And today it's my opportunity and to share my learnings with you all. And as I said earlier, this was the presentation I was made in another forum. I'm going to share with you. It is useful for you also. What do you mean by counseling protocol? And the word, when you look at these two terms, you can find out there are two terms are there. We'll just look into that what it means. One is counseling. And in a layman perspective, when you ask anybody, what do you mean by counseling? It is a form of talk therapy. And whether it has an impact, yes, there are many studies were conducted on talk therapy, and it was proven that when you given a counseling, you can able to make a change in one's behavior and emotion and thought process. And so that is counseling is nothing but a talk therapy. And there is an when you look at that in detail, in depth about that term, in the different standard reference book, you can find out that counseling is a process. It's not a component you can take and complete within a minute. It's a process where the clients are having the many problem or conflict, or they are unable to make a decision. Where the counselor will play an important role, will make an enable the individual to make the decision for the problem they are facing. They are not giving to them; they will enable the person to make a decision. So there is an interpersonal communication between these two, where counselor play as a facilitator and enable the counselor to make right decisions. And they will justify that, okay, they will get it everything from the client perspective. So for example, I'm having the problem. Imagine that I'm the client, you are the counselor, I'm coming to you. As a counselor, what you will do? You will say that, okay, the problem which you have, there are three solutions are there. There are three opportunities are there. In three ways you can able to solve the problem. And as a counselor, you will inform me, you will facilitate that, okay, if you take the problem, solution number one, what are the benefit and what are the demerits? And two and three, the likewise, you will give all the inputs, and you will not suggest me that you can take this intervention for your problem. No, you will say them these were the benefit and demerit, and what one you would like to take. You can make your own decision. It is called non-directive counseling, and most of the counseling process they prefer to go for non-directive counseling. As you all aware about it, there are types of counseling are there: directive, non-directive, and eclectic. Eclectic very rarely used, and non-directive, as per my knowledge, 85% were used, and 5% eclectic, and 10% directive counseling. And I have to give one more important thing here. Directive counseling is one-to-one counseling where the person who is not having the ability to make a decision, even if we give the importance of different solutions, for example, children, and those are having that consciousness problem. The conscious, those who are unconscious, you cannot make them make a decision by themselves. And those are having severe mental illnesses, special population. These were the population. The directive counseling will be more effective, but at the same time, for normal people who can able to use their inductive and deductive reasoning, non-directive counseling will be the best one. Okay, and if you are a person who is practicing counseling, it may be on any perspective. It may be academic or personal, whatever it may be. Try to go for non-directive counseling. And I used to give an example for this directive and non-directive counseling. Non-directive counseling, that counselor will give all the instruction to the client or the counseling, and they will utterly follow without any deviations. Non-directed counseling, he will not say anything at all. He will facilitate you. He will say that what is the merits and demerits and make you to make your own decisions. So that is the basic difference between these two. And it is in layman, I will give an example for directed counseling and non-directed counseling. Directed counseling is on arranged marriage. Non-directed counseling is on love marriage. So why I am saying that in arranged marriage, if there is a problem, you can complain to your parent. You only select it. Now I am facing the problem. You have to come and resolve it. Likewise, in directed counseling, when you give some suggestion and if it is not working, the client will come to you and you only told me that it is not working to me. They may ask you. But at the same time, in love marriage, you cannot blame anybody else. The decision was made by you, and whatever you good or bad, you have to follow. Just move forward. Okay, I hope you understand that. And I think I given a lot of input regarding that counseling. And important thing in the counseling is that the counselor will enable the individual to make their own decision for the problem what they are facing. And now we'll move on to the next term in that today. It is about protocol. Protocol is nothing but we can say now in a family you may have the rules and regulations. In your family or when you go to certain places, religious places or some public places, they are having the protocol. Protocol is nothing but do's and don'ts or rules and regulations or set of standard created by the particular area people, a particular culture that we can call as a protocol. Here in counseling also we are having the protocol. There are rules and regulations. There are certain do's and don'ts in counseling. So that is called counseling protocol. And I can say that if you ask me that, excuse me. If you ask me that those who are working in a counseling sector as a counselor, and we cannot expect that they know that all the rules and protocol and they are following. No, first they start and they come to know that the ethical practices and almost all the unit when you take any kind of counseling program, and you can find out ethical component will be there. There they given that what are the things you have to do that when you are taking the test. So these are the rules and regulations. When you're giving the report, these are the rules and regulations, ethical practices. And ethical practices are nothing but protocols. What you have to do, what are the things you should not avoid in the counseling process. So in generally, the protocol means rules and regulations. And again, there is one more confusion will come, and it comes to me. What is the difference between rules and regulations? Okay. And you can say that rules and regulations, these were the terms generally you may hear, even I too hear in my life. And the difference between what is rules. Rules are a prescribed guideline or action or regulating principles. Okay, it says that, okay, these are guidelines, how you can do that. That is the rules. And regulations, on the other hand, you can find out, mostly it is done by the regulating authority. For example, for a psychologist, as of now, we are not having any association. For rehabilitation component, there is an RCA is there. For medical, they are having the Medical Council of India. For legal, Bar Council of India. So these were the authorities or government bodies, they will have the regulations. They will issue the order, what are the things you can do that. It is like having the law enforcement. Okay, regulations is, there is an authority will be there. Their nodal agency will be there. But in here, it's not such a thing. It may be for the particular component, they given that, okay, if you are going for behavioral therapy, if you're going for behavioral therapy, they given that, okay, these are the things you can do that. Like components, like component. Okay. And the another one is in the rules. The terms can be used in general perspective, like guidance and counseling. Okay. So rules are like a guidance, generic in nature, but here they are more specific and they will spell out that each term. That's why when you look at that document, that constitutional document or any law document, and all the terms will be explained. Even if they for abbreviations, if they use, they given that meaning for the abbreviations. Everything will be detailed. They given that. What do you mean by youth? What do you mean by punishment? And how many? The details will be explained in detail, and everything will be legal for the legal sense. Okay, it's for not general perspective. It's for legal. If someone is avoid that already frame the regulations and what are the punishment he will get. That kind of clear-cut legal components will be there in the regulations. And here in rules, we can see that it can be adjusted accordingly whenever we need. And we found that certain, for example, chloroquine, there is a medication name, I think they prescribed for corona, which is taken for malaria and which was widely prescribed for preventing corona in almost all the countries. Even US threaten as India, you have to export that medicine to them. Okay, and the rules and regulations, which, for example, a few years back, the government given that these medicines you can take, and after some time they said that no, these medicines are having some side effects, so you can discontinue. Like they, for example, uh, I think I forgot, Paul something. There is a product, there is a company, the pesticide which was totally banned in Kerala, and they found that it has a huge impact on autism in that the particular Wayanad area. And the rules can be changed according to the needs and requirement of the particular company. But here, regulations are very rigid. They will say, no, regulate that article number 3, 14, 21, it cannot be changed very hard. You cannot change them. It is given to that. For example, right of speech is a regulation. If it is there in the law, you have the right of speech and freedom to speech. Everything is there. And we'll come to here in the rules, the final one. And mostly it is on a small group of organizations or specific social structure. Authorities will frame these things, and it varies from one organization to another organization. For example, you can take one example in counseling itself. We are having different perspective to deal with that. So one perspective is that behavioral perspective, cognitive perspective in psychodynamics, and clinical component, and the humanistic perspective. When you look at these things, for applying that counseling component totally vary. You cannot see the same kind of regulations will be in all the perspectives in counseling. But on the other hand, they given that, okay, APA given that counseling protocol means the regulation says that you have to do that. You are not supposed to avoid that, consent from everything. And the government, the country may given that strict rules and regulations. I come to know that in India, we are not having that any specific guideline for the counselors as of now, I can say. But if you are appointed as an education counselor, just imagine that in a school, if you go to that regulations of right to education in 2002, so there they given that some guidelines for that. What are the roles and rules and regulations they have to take? Excuse me. So now I hope you get a clear distinction between what is the rules and what is the regulations. Rules can be changed. That is one thing, and regulations you cannot easily change that thing, and it has a legal connection with that. That is the basic difference between. And mostly, if you are associated with the government having the norms. I come across that in the United States, you cannot use the same norms for all the states. And in California, there will be a different norms, regulations will be there. And when you go to that another state, and the 50 states will be there in USA, and all the states having the different regulations. And that is the things we have to understand it. And when you void that regulations framed by the particular state, and you will be prosecuted. And I think one more thing you have to understand that in the protocol is one is the rules and regulations, another is ethics. What do you mean by ethics? Okay, there are many questions we have to keep in our mind. For example, there are sometimes we may know that why is a counselor inviting a client home for a problem? Is it okay? You can invite your client for your home after the first session. Is it ethically correct? I think all agree with me that no. You are not supposed to invite the person for any kind of family functions at your home. And there are some people may think that the counsel can become a friend of somebody else. So, sorry for the disturbance, and I will continue here. And so there are certain ethical principles you have to follow when you take up the counseling. One is about you are not invite the person who is taking the counseling. Immediately after the first session or second session, you are not supposed to do that. I would say that there were, for example, some of the association, they given the guideline for that. And some people, they may think that, can I become a friend of the counselor? Can I become a friend after getting the counseling process? You look into that. No, they are saying that when you can become a friend of that person, and what is the distance, how you have to make a distance between the client and you, and when you have to make a contact, and you have to have the boundary for your counseling and personal life. That's the important thing you have to keep in our mind, that comes in the ethical process. And one more thing, you may thought that they may invite for the family function, and we may have the family, whether we can invite them for that functions. There are some also the ethical principles are saying that you are not supposed to do that. And sometimes we can find out, generally what we'll do when we meet a new person, we'll give the gift, okay, and they will give some token of love to somebody and to maintain better relationship. Whether it is ethically correct, you can receive such a thing from your client, your counseling. The guidelines saying that ethical principles are saying that you are wrong. And we may thought that why should not we have the counseling process in general public place, in a park or coffee shop, whatever it may be? Why we are not taking counseling component? And important thing we have to understand that ethics and counseling we have to take only to ensure the safety and privacy of an individual. Okay, and there is one more reminder from my team member. Let's do that. I think friends, you can become an Insta, yes, that's not a problem, but immediately after giving counseling is not supposed to do that. Immediately after that, we can see that given the guidelines for that. So here are some of the things you can, how the counseling environment should be. So first in the counseling protocol, not only include rules and regulations and ethical principles, and you have to maintain that infrastructure and what are the environment you must have for your counseling. That also comes in the counseling protocol. They say that you must have this kind of structure. I will give one example. And when you visit to the NCS, National Career Service, they've given the guidelines for in a providing counseling setting, how the setup must be and what are the things a counselor must have in their counseling environment. Everything they given the detail. So that also comes in the protocol. That also comes in the protocol. For example, the environment must be welcoming. When some client is coming to you for their problem, and you have to give a space to them to sit in a space where they can sit, and then whenever their turn is there, and then they have to register, and the problem may be taken by that front desk people. And if you are not having such a facility, you can when the terms comes, and then you can ask them to go for it. The next one is make them comfortable, and when the client feel that and uncomfortable when even for their sitting, the counseling will not be fruitful one. I think that's why when you take any kind of experiments in psychology, in counseling process, they will ask, are you comfortable in sitting? Why sitting is important? It's very important. You have to ensure that are you comfortable in your sitting arrangement. If not, please let me know, then I will make an arrangement. So the environment must be welcome. You have to make, and then sitting arrangements should be better and convenient to the client. Next one is there are many places there are distractions will be there. That open one side window will be there. There are other people who may speak, and no distraction must be curtailed, and you should avoid. And I think in between I found that some of the counselors say, can you please wait? I am listening an important call. They will attend the call, but you are not supposed to do that. When the client is there, you have to give priority to them. And when any interruptions from the family members or any person, and free from that any disturbances, that you have to ensure. Next one is the privacy and confidentiality. And important thing. And even they said that I marked something, you have to maintain the privacy and confidentiality, that whatever you shared here in this counseling environment will not be revealed to anybody else, unless there are few conditions are there, and they said that I'm going to murder somebody else. So only those conditions only you are supposed to reveal this information to the law enforcement officer. Other thing, even they said in the past thing you are not supposed to reveal anybody else unless they are asked. And when they were asked, for example, in court and other judiciary section, if they seek that information regarding your claim, you can give in that private consolidated report, a closed format only. The next one is non-threatening. The environment should be non-threatening. It should ensure that facility to the client who can able to reveal their information. I think when they feel comfortable and when you put the rapport and when they feel that the environment is good, yes, this is an appropriate place we can reveal the information to the counselor, then that is the right time you can get the information from him. So this is the way. And another one is code of ethics. And the practices are there. Some of them are here. I'm going to share with you. So first one is we have to ensure the relationship between that counselor and client. Okay, why we have to ensure that? Once if you are not having the better relationship with your client, the rapport building is rapport. If you are not maintained, if you are not having the better relationship, and it is very difficult for you to ensure the well-being of the client. And it will be a very big task. There is a powerful Tamil. When you are not having the better initiations and good initiative in the beginning, and it will be late, end into that wrong compound. That's why starting must be very good. And you felt as a counselor, you felt that this counseling is not started very well, you can inform them. I hope this will not yield a fruitful result, you can find it somebody else. Nothing wrong in it. And there are some counselors, they will take whatever the problem, even they don't know, from their perspective, they will call them, okay, sit down, I will try to give answer for you. Don't do such a thing. And when you do that, then your name, you may thought that your information, your detail will not be revealed to them. The tipping point, there is a word, is mouth to mouth. That famous doctor, famous counselors, how they come to know that, they will say that I went them, I felt more comfortable, and he is very good person to solve my problems. So these tipping my word to word, mouth to mouth will make them famous, and when you do other thing, if they may easily know about your qualities, very short period of time, and you will suffer a lot. And as I said very clearly, okay, sometimes the client may have the problem, and the problem may be they try to, we are building the trustworthiness and confidentiality and rapport. After building the rapport, we are saying the information, and don't use that information to client to become a vulnerable, and don't abuse them. There are certain cases it may happen. It may be an emotional or sexual or psychological or intellectual or physical. This is very important thing. You are not having any rights to abuse the client. And I would like to quote one of the incidences I can see. It was in telecounseling, and the person who contacted and said that the client said that I'm not comfortable with these things, and I already informed the practice. He told me that unwantedly, how you can say this kind of words, saying to the client. You are not supposed to do that, even though the person's perspective and your subjective perspective are totally different, and don't conflict in that place. You have to agree that we have to value that inputs given by your client, and don't misuse the information given in that counseling process, and don't abuse your client in any form. The next one is sometimes we can find out now in India that's not a possible, and if you are not confident, they will not come for your second session itself. But in other countries, they are having that when you take up the counseling, they will inform them you must come for 6 sessions, and they will collect money for all the 6 sessions in the beginning itself. So, and sometimes it may lead to some of the problem, it may take 18 sessions also. And as a counselor, one of the important code of ethics is try to minimize the number of sittings, number of sessions between you and the client. So it is another important code of ethics. And as a counselor, you must ensure that confidential of an individual. So how you can ensure that? You have to disclose that. Okay, what are the information given to you? Can I reveal to anybody else? What are the things which are disclosing here in the counseling setting? Can I record? So these must be ensured in the beginning. It's a consent form, and everything must be. Suppose if you are not get benefit, if you are not having any improvement in the counseling process, what are the things you are the things you can expect it from the counselor? And if not met, what are the things you can go for it? And we can see the conditions applied. So these are the disclosures we have to make to ensure the confidentiality of the claim. And next one is sometimes where you qualified as a counselor, you are saying that I'm having that certified counselor, I'm having the degree in that particular area, and I'm having the experience. and you have to give that provision to that. It may be on website or any kind of platform, and you have to reveal your things. They can verify your details whenever they want. But these informations, they can have the capacity to check the competency of the counselors. This is one of the code of ethics. You have to ensure those things. The next one is you must provide that. Suppose if you are conflicting with the counselor, and you have to give the provision to file a case, file a complaint about that you are not satisfied with that. These things you can ensure that. Next one is ethical standard. There are many questions you are putting in, including I will try to answer all your questions. Another 2 or 3 slides only I'm going to take. After that, I will try to give answer for all your questions. Next one is ethical standards. What do you mean by ethical standards? Ethical standards are normally by the, you can see that there are many professional associations are there. For example, AP, American Psychological Association, or Australian Counseling Association, and American Counseling. These were associations. They come up with them standard norms, and these norms will, they will educate the members the ethical conduct among all the members. Okay, what are the things you have to do that? They will conduct a training program. And if there isn't someone who has violated the norms, what were the outcome of that thing? And they will have the case studies, and they will provide accountability of all the members in the group association. So these things you can find out in the association, and it will help them to improve that. Some of the people they may not aware about. Even there it is there in the theory, but when they come to the practice, that is totally different. I will give one example. The consent form. I think you may study about we have to get a consent from the client. And how many of us we are having that model for that? When you go to the different institutions, they are having the different form. And when you become a member of association, and you can get these details, they may give a clear outline or template for them. Okay. And so here is an AAC, American Counseling Association. They given that some of the these ethical code of conduct to the counselors, anyone who want to take up. One is an autonomy, justice, benefits, and fidelity. So these are the 4 important code of ethics they can practice. So what are the components? The 8 sections they built. One is on counseling relationship, confidentiality, and privilege, communication, and privacy. I'm giving that outline only. In the coming slide, you can see the detailed component. Professional responsibility, relationship with other professionals. There will be many people who are thinking that the counseling profession need not have the connection with or relationship with other counselors. No. They are saying they are insisting you must have the relationship with other professionals. And for example, if you are a counselor, I need to have the support of occupational therapists and many other people. So these things we have to ensure. Next one is evaluation, assessment, and interpretation. What are the procedure or rules and regulations you have to follow? And supervision, training, and teaching. Research. And when you have the client and you found that the particular strategy you have adapted for that counseling process, which was successful, and you can publish those informations. And even if it is an unsuccessful, also you can publish, because other people come to know that, okay, when we use this technique, it will not be successful. And suppose if there is a conflict or somewhere there is a problem, and there are many clients who are raise the component, and we can take up that ethical procedure and it can be resolved. So these were the important 8 principles they mentioned. And they said, no, our relationship after 5 years only. Somebody asked me, we should have that relationship only after 5 years. And here you can see privileges, and there are many privileges are there for the client. But many responsibilities, we should not reveal any kind of private and information to the client of ours to anybody else unless they are getting consent from the client. And we have to maintain the better relationship with the client, and it must be very confidential. And you use that, don't use the client name in your document. You have to use a code word, and the code word can be, or the particular number can be noted in your master diary, where you can have that particular component. And those who are doing medical transcription, they will know very well about those things. Next one is evaluation, assessment, and interpretation. I think when you, for example, when you go to the scan center, you will get a scan report and who has done the evaluation and what kind of method of assessment used and what was the interpretation for the particular assessment made. These details likewise in clinical assessment also, in counseling assessment also, how to make, and certain things they will say that they may say that this instrument is not for suitable for children, but why you have taken? So these things we try to give the answer for them. And we have to ensure as a mentor, we have to find out and we have to get an input from them. As I said, once you have a better outcome in your counseling process, you can go for publications and do the research. And as I said, now when you have the conflict between counseling and the counselor, and it should be resolved by using that code of conduct which were already developed. And then finally here I would like to quote one of the important thing, making the decisions. So which code of conduct and which one we have to follow? Generally use the common sense, whether it will useful for the person and whether the person may go wrong or against us. Use the common sense and don't hide anything. We have to follow in the counseling process logical course of action. Okay, the first one, introduction, rapport building, and you have to inform them. And many people may think that they come for the counseling and immediately after you are giving that counseling, they have to solve the problem. Such a people will be there. That's why you can find out that solution focused breath therapy is very popular rather than the traditional therapies. So, and suppose if you are having that doubt, you have to go back to the manuals which is given to the professionals, rules and regulations which is there in the framed by the association or regulating bodies. You can go to that and we can check that and what are the things we can do, what are the things we have to avoid. And when we are making that decision, there are three options are there, and we found that which one is best. Even that client, you can suggest them what is the benefit out of taking the particular compound. For children, if you want to make any behavioral modification, my suggestion would be for behavioral therapy rather than cognitive therapy. So these things you can say by your experiences, what are the things I found out. And for professional competency also you have to ensure, and continuous education is very, very important. Even though you may have that master degree and PhD, and you have to ensure that wherever the training program or workshops are going on related to that professions, and you can take up and you have to participate and you have to develop your knowledge in that particular area. And for example, you may gotten training in the particular area, don't deviate from that and don't give training to all the areas. I can see that they may have the certificate only, but they will do everything. And other terms which is there used in code of conduct are liability, negligence, and malpractice. These are the terms I think you can able to find out. And some people will say that even though you may be well qualified, they say that you are malpracticing. And you know the difference between these terms, and you have to ensure these components you are trying. I can say that as a practicing counselor, you must follow at least any one of the association. It may be an Indian association or any kind of international association, or in your state body or CBSE, they are having a school counselor model, or NCS, they are having career counselor model. You can take any one of the model and you can follow for your betterment. With that, I can stop here. I hope these informations are useful for you. And if you have any questions, please let me know. I will try to answer your questions. Thank you. And read out some of the questions which were typed earlier by Dr. Chandra. Family and friends compel us to do counseling. Friends, I believe. I think, as I said, now even the doctors, they important component is that we are not supposed to do it for our family members, because why they are not saying that you are not do counseling to that family members, they know about you, and there is a chances are that bias will be there, subjective bias will be there. That's why you have to go to that the person which is not known to us. Especially the family and friends are not supposed to give counseling. You can give that over guidance to them, not a counseling. That's my input for your question. And I think there's a question why you have to follow ethical code of conduct in counseling process. I think we may say now just the good person and bad person. Okay, the good person having that all the good values, and when you follow the code of conduct and ethics in counseling, you will claim as a very good counselor. So that is the basic difference between these two. Yeah, so these were the three questions I found in that chat box. I hope these answers are useful for you. And if you have any other questions, please let me know in the chat box. I try to give answer for your questions. Thank you so much for that wonderful opportunity. It's a great pleasure to share that learning. Thank you. What is the actual academic quality counselor, sir? For example, Counselor, the term is on psychological counselor. And even there are, for CBSE, they are saying that UG plus certificate course. It varies from one place to another place. And another place, they are saying that PG, master degree in that counseling. And when you look at that, some of the institutions, they are saying that diploma or you have the certification in counseling, you are eligible to do that. Vary from one place to another. And then even for association itself, they are differ in that component. And as I said, now when you want to practice as a academic counselor or a relationship counselor, you must take a course which is given, for example, in as I said, now different state in USA, they are having separate rules for that. When you want to become a relationship counselor or sleep counselor, sleep related counseling, if you are providing, you must take the certificate course in that area, and if you are having a specialization, you are allowed to do that counseling. It varies from place to place, but in India, even if you no one will ask you whether what kind of person. As of now, there is no regulating body, as per my knowledge. Yes, I think my side is over, and over to you, the team members. We'll go for a physical word of thanks.
Thank you, Dr. Suresh sir. It was a nice, wonderful session. And counseling protocol, I think we missed, I think, this after 270 sessions, we are had it now, but it's very, very important, I feel, for the professional psychologists and practitioners. And I can remember, sir, as you said, like non-directive counseling, you said 85% of the people, so this type of counseling they are using. You said we have the decision making by the counselor, not counselor. I can remember that one of resource person in marital counselor, she explained that we are not the matchmaker. So we have to give the guidance, they have to take their own decision. So you rightly pointed out this one, so this type of counseling, non-direct one. So I think we have to follow that one. And the ethical process and protocols very well explained, and particularly rules and regulations and differences. Very, very nicely you differentiated, sir. Like prescribed is the guidelines and the rules issued by the authorities. Authorities can issue the rules. And guidelines can be from counselors, can do that is the rules, and nicely differentiated, and it was a nice explanation, sir. And a lot of ethics you said, like why should not be the friends, why should not attend get together, and why should not give the gift. And
Sir, your voice is not audible now.
now it's okay, sir.
Okay, sir. Thanks.
Yeah. So a lot of ethics, important ethics. Why should not do? Why should not do in that way? You explain a lot of things, and particularly you suggested to follow any one of like code of ethics, like American Counseling Association or whatever the ethics is, we have to follow. So that these are a lot of practical for the practitioners. These are the guidelines. Definitely will be helpful even for the budding practitioners as well for the industry who are in the industry. As you said, professional competency, we have to then and there we have to do the trainings and we have to update our knowledge skills. So in that way, this sessions, protocol session, it will be useful for the beginners as well for the who are already in the industry. So nice session, sir. Really knowledge transferring session. I will appreciate that. So kindly accept our gratitude from the American College Madurai and MS Chellamuthi Institute Madurai and Madras School of Social Work and International Center for Clinical Psychology Germany and Psycho-Oncological Society Turkey and Red Pond Educational Psychology Research Center Madurai. Thank you, Dr. Suresh sir. And in your way, we can go like 1, 2, 3 in protocol also, because he covered a lot of ethics, American ethics and general ethics, code of ethics practices and rules and regulations. So I believe that he can give 1, 2, 3, one on each session. He can cover one thing. So part 1, part 2, part 3, something like that. So it will be elaborate session for the practitioners. Thank you so much, sir. Thank you.
Thank you, sir. Thank you so much. Thank you all for your wonderful feedback and the comment and the questions, everything. Thank you so much. We'll meet again in another session tomorrow.